My name is Mayling Armijo. I'm the Director of Economic Development for Bernalillo County. I just want to introduce my staff. We have Marcos Gonzalez, who you saw walking in, and then Swen Chavez and Sulema Lenz, and then Tom Thorpe with PIO. So they're the kind of, that they did all the logistics in putting this all together. And then Margarita with the Director of Behavioral Health Services, if you'd stand up. She worked to get the speaker, her staff worked together to get the speaker panel together. So it was definitely a team effort in bringing this together. One of the reasons we thought of this was because businesses, one of our charges in economic development is to identify the needs of businesses, and one of the needs was understanding behavioral health in the workplace. So we put this together, and we hope it's very informative. I just want you to know that we are live streaming this so that people that could not attend are able to access the information. Before we get started with the actual program, I want to introduce Commissioner Hart Stebbins, who was elected chair of the commission January 8th of 2019 and currently serves as the Criminal Justice Coordinating Council and the chair of the Albuquerque-Bernalillo County Community Schools Partnership. In her time on the commission, Commissioner Hart Stebbins has focused on ethics reform, expanding local economic opportunities through responsible job creation. Commissioner Hart Stebbins has always been willing to listen to county residents in response to their needs. Commissioner, if you just want to stand up and wave so they know who I'm talking about. She's also the sponsor of this program, of this summit, and I know behavioral health is a key issue for her, and making sure that the community and its constituents are well and healthy and have access to resources. So without further ado, I will introduce our panelists today. We have Juliet Kinkade-Black from the All Faiths Counseling Center. She's their Director of Clinical Services. And Deputy Ian Dunbar with Bernalillo County Sheriff's Academy. Enrique Cardiel, Bernalillo County Health Council. He's the Executive Director of Bernalillo County Community Health Council. And Mary Perez with University of New Mexico Hospital. She's the new Executive Director of the Adult Psychiatric Center. So I will let Juliet start. Go ahead, it's all you, Juliet. Thank you. And thank you all for being here.
Thanks, Mayling. Can everybody hear me all right? No. How about now? Okay. My name is Juliet Kinkade-Black, and I am the new clinical director at All Faiths Children's Advocacy Center. We have been the trusted advocates for children and families who experience trauma for about over 60 years. So it's really an honor to be able to join the team. Before joining All Faiths, I was a marriage and family therapist, and I don't know. Maybe I could just get closer. Before joining All Faiths, I was a marriage and family therapist and a SAMHSA grant director in Oakland, California at the Native American Health Center, but I am a native New Mexican. I grew up about an hour down the road in Santa Fe, and I'm a proud graduate of UNM. So mental health in New Mexico is something that's really important to me and dear to my heart. So All Faiths offers a number of services. Probably our most utilized service is mental health therapy, outpatient counseling. We serve children ages birth beyond 18, so if they come in our doors before the age of 18, then they can stay with us as long as they need services. We also provide services to their caregivers and family. Therapy that is really focused on alleviating the impact of trauma so that caregivers can offer the best parenting support possible to children. But in addition to therapy services, we offer CCSS, or comprehensive community support. So that's people who can go out in the community and support kids in the school, in their homes, and in really getting back to a healthy baseline so they can keep developing and growing. We also offer training throughout the community. So a lot of it focuses on trauma and brain science, and we do a lot of that with the schools and with other service providers, but we also offer training to the rest of the community and have recently developed a training institute to try to meet the needs of more people within the community. We do placement services, so we offer private adoptions, and including to LGBTQ community, which is a really great honor to be able to provide. And we do home studies, so families who are preparing to be foster homes or preparing to adopt need a home study in order to move on in the process, and we do that as well. And then we provide forensic interviewing services to children who have been witness to or victim of a violent crime. So we're pretty comprehensive. Mayling, will that suffice for now, or do you want a little more?
No, that's great.
Great, thank you.
Deputy.
Hello, my name's Ian Dunbar. I don't know if mine's even on. I'll steal yours.
Share.
Deal. My name's Ian Dunbar. I've been with the Bernalillo County Sheriff's Department for about 7 years. Prior to that, I was with the Albuquerque Police Department, so I've all in about 10 years in law enforcement. I'm currently assigned to our regional training academy. I teach at the basic level with the cadets as well as law enforcement around the state and nation. Something that the Bernalillo County Sheriff's Department has began to offer about 2 to 3 years ago is active shooter training for the civilians in the county area and really just within the state. Unfortunately, in the climate that we face around the nation, it's obviously something that we're seeing more and more often. It's a more frequent problem, and something that the county looks at doing is attempting to offer training for staff and individuals involved in either, whether it's a government facility or a privately owned facility, some type of training to make sure that the staff and personnel involved in that building or that workplace are trained in how to react and how to survive an active shooter encounter. It's not something that's, is something to be prideful about or anything like that. It's something that is a fear around the nation right now, and it's taken seriously within the county, and we want to get ahead of it. I've personally done probably over 100 classes for any company around the Albuquerque metro area and the Bernalillo County. So if you or anyone that you know owns a company or is involved in a company, a school, a business, even a government entity, that's fine. The curriculum that we teach is developed by a company called Alert. So it's not actual county curriculum. It was developed as a federal thing around the nation. So something that's really unique about the training that you would receive if you come to us is it's the same training that someone maybe in Rhode Island would receive, or California, or Maine, or New Hampshire, you name it. It's a nationally recognized training, and I would probably be the one to go through. If there's any questions, you can get with me after. You can ask anything you need. I'd be happy to put something on, or if you know somebody else, you can refer me as well. Something that we do harp on is it's not just for like the general population. It's specific to a individual workplace or some type of government entity. And the reason for that is if we shed more light on active shooters, studies have actually shown that it can increase the chance of creating active shooters in society. So what we're trying to avoid is just, putting on a seminar for the general public and instead just offering it out to specific businesses and things like that. That way everyone is trained in-house, and hopefully it can be a deterrent as well as a survival tool for anybody that receives the training through us.
Thank you.
Good morning, my name is Enrique Cardiel. I'm the director of the Bernalillo County Community Health Council. We used to be part of Bernalillo County. We're currently a nonprofit. We have an opioid accountability initiative, so we work to prevent opioid misuse. We also work to prevent opioid overdose. So we can come out and do Narcan trainings. We can do trainings on safe storage of opioids. We're about to start working on underage drinking and underage opioid use prevention. So we'll probably be partnering with the county and their underage drinking prevention work pretty soon. We do healthy eating, active living work through Healthy Here. So we could, if walking, getting out and exercising, taking a break from staring at your computer is something that's good for people's physical and mental health. So we can help you coordinate a group if you want to do that. We're also working on gun violence prevention right now, and we'll be working on that for quite a while, I'm sure. We started an violence prevention initiative in November before I became the director, and in partnering with the city of Albuquerque, they want to focus on gun violence. So, if you want to be part of that have conversations with us and help us think about that, we'd be more than happy to work with you. We haven't worked with the Sheriff's Department yet, so
Thanks.
looking forward to being able to partner with them as well, right? The city has their focus, right, which is city limits, but the Health Council works for the entire county. We will also be looking at city and county bus routes to see if they're effective, if they're helpful. So some of you who may want to advocate for a better bus route close to where you're at, you can get with us. That'll be part of what we're doing, is looking at where bus routes need to be improved for services, but also for employment, right, for economic development, because we see that as a component in behavioral health and general health, right? If people can get work, they tend to be healthier. And there are probably things I'm forgetting, but I will stop there for now. If you want to participate in any of those groups or have any of our training, I have a stack of cards and I'll be happy to talk with you afterwards.
Thank you, Enrique.
Thank you.
Mary?
I'm Mary Pedis. I am the new, is that better? Mary Pedis. I'm the new executive at the Mental Health Center or University Psychiatric Center. I have worked there since 2008. At the Psychiatric Center, I've been the director of the Psych Emergency Services and the Inpatient Acute Services. I've worked at the hospital since the late 80s. I worked with Dr. Andy Shee, which some of you might know, in the Los Pasos program. I've worked at BC Stop. Does anybody remember that? Probably not. Bernalillo County had a street outreach program, and it was a harm reduction model. I worked with that voluntary for a while. I'm very passionate about substance abuse and mental health, and so that's what brings me to this job, and I feel lucky to be invited today. We have a number of different services. Most probably are familiar with the psychiatric emergency services. We see about 700 people a month. 70 to 80 of those are children. When I started in psychiatric emergency in 2012, we were seeing about 5 kids a month. So the number of children has really risen. We are seeing about 200 people a month dropped off from law enforcement or APD. Our patients are much more acute, and we're seeing a lot more mental illness in combination with meth abuse. Seems to be a big problem for our area. We provide acute inpatient services. We have had some struggles with increased length of stay and increased readmission, and it appears when we look at those that that's also seems to be a mental illness in combination with meth abuse or other substance abuse. We have outpatient services that include START Clinic, which is where people get assessed and they begin, and we decide, do they need short-term care, or do they need long-term care? The Recovery and Resiliency Program is a mood disorders clinic, and we have then COPE and iCope, which are long-term services, long-acting injectables, things like that. iCope is it's like a psychiatric health home for patients who have long-term mental illness. We have some cutting edge therapies where Dr. Quinn is doing TMS, which it's similar to ECT, and it are the old shock therapy, but it uses magnets instead of an extra electrical jolt. And those therapies are kind of like shutting off your computer and turning it back on to get it going again. They're very effective with depression. And they use it in some patients with dementia and bipolar. We have a whole new psychotherapy clinic. Actually, we have different tracks. So we have trauma tract, we've got substance abuse tract, depression, bipolar. We have a lot going on with peers, and are working on, we're in the process of remodeling to provide like a living room space for our peers. And so that's where people can kind of drop in and get support from one another. We're running a lot of peer-based groups. We're up to 18 peer volunteers, and have really good coordinated effort along that. We have something called the Consumer Family Advisory Board, and that seems to be gaining momentum and more, we'd welcome anybody to come to that. And I have cards here and I can get you the day and time. It's usually on Friday at noon. And our level with the psychotherapy groups, we have included a lot more doctoral psychologists, and we are doing training on the different evidence-based practices in that area. We are collaborating with Project ECHO and the Integrated Addiction and Psychiatry Clinic to we're working to collaborate with the New Mexico Primary Care Association and find out what our rural partners need in terms of support and how we can better help them. We've collaborated with the county on the MO2 clinic, which serves the patients who are in MATs. And we're working and set to open the crisis triage center. And then, of course, we have our ASAP program, which is our substance abuse program, or they offer medication-assisted treatment. And I know that there's been concern about a waiting list for these patients, and we've got actually 2 different ways that people are offered. You can attend 3 groups and jump the waiting list, and then we're calling the first person each day on the waiting list to get people in quicker. So if you're motivated, that's being offered. And we're probably our biggest problem that way is providers. And sounds like UNM school is gonna start offering free medical school to people who will commit to staying here. So hopefully we can get more providers on board, and we're actively recruiting even outside of New Mexico. So we have a bunch of community-based services partnering with the city and the county. We've got jail diversion, RRC, which is the Recovery and Resiliency Center. We have CareLink. We're partnering with to provide services for Medicaid patients. Community Connect is a program where people get case management and are also helped with housing. PSR is our psychosocial rehab, and it's they offer classes similar to CNM for our patients. We have the comprehensive community support, which is case management for patients. And then we've got an ACT team. So for the sickest of the sick, we go in the home. It's like psych home health, you know. We have different people who will go visit social work, nursing, case management, physicians, and see the patients in their home. Probably, if I had to say what is our specialty, we've had lots of discussions about that. Probably if you have a really complicated person that, you know, is not being helped in other places, that would be our specialty. I would say if you are trying to get a hold of someone or get someone into the system and have not had any luck with doing that, because I think that sometimes people feel that it's not easy to get someone into UNM, will you please call me? You know, again, I'll give out my card, or call the main number and ask for the executive director, and we'll make sure that we find a way to get you in wherever makes most sense. I guess that's really all I have.
Great, thank you. That was a lot, so we'll definitely get your card and maybe a link to the website and kind of all the information. And then this is Dr. Bill Wagner. He's with Centro Savila. He's the executive director and founder. And sir, if you'd introduce yourself and talk to us about Centro Savila.
Sure. Am I on? Yeah. So my name's Bill Wagner, and Centro Savila is a outpatient, I'll just say a health organization, because I think sometimes we make this distinction between behavioral health, mental health, and other health, physical health, and it's really not that helpful when you think about health. And so, but what we do is provide a lot of services to individuals, couples, families, to really help hopefully prevent other illness, move our services upstream. We're a nonprofit that started in 2011, and we started in a house along Isleta Boulevard in the South Valley, really with the intent of bringing services to an area of town that really doesn't have enough services. And you know, we intentionally put our clinic right next to the bus stop so people would have access. Transportation is a huge issue for people trying to get access to services. And we made our services available to people regardless of their ability to pay, which is also a huge barrier for people accessing services. And it's taken, you know, a lot of creativity to figure out how to make that work. The Savila plant is the aloe vera plant, and so, you know, we could have called our clinic the community mental health center of the South Valley or something like that. But because there's so much stigma attached to accessing services like ours, we chose something that had a real positive image within the community, and you know, really speaks to the resilience of people. So we look at it as a strength-based approach that, you know, we all have, if we want to call them mental health issues or issues, or we know somebody in our family or friends that has struggled with depression, anxiety, had a traumatic incident in their life, and it's really impacting them. And we know that a lot of times that is the underlying cause for other illness. So, you know, chronic disease, diabetes, high blood pressure, those are very related to people's mental health. You know, things like substance use disorders, things like, you know, just not being able to function because of anxiety or depression. We want to really try to address those in a holistic way by providing, you know, counseling when needed, but also looking at social determinants of health. So if you're not familiar with that term, that's really everything, including transportation and you know, where you work, the things that surround us that aren't often associated with health. But we know that about 80% of our healthcare issues are not things that get resolved by just seeing a doctor. And so we're trying to address those through a lot of case management services, a lot of networking, making sure that we're helping people to navigate systems that are not always that simple to get through. If you need food, if you need access to health insurance, if you need, to get a driver's license, sometimes people really get stuck in the system, and we're trying to not only just give them a brochure, but walk with them through it if they need that. We have several programs now. Since 2011, we started in the building at 1317 Isleta, and we've partnered with the county and the city to expand our services. We have a program that through really, I think, the foresight and awareness of how serious the issue is here in Bernalillo County, that county commissioners like Maggie Hart Stebbins and a lot of the folks that are concerned about the greater health. There was a ballot initiative back in 2015, I believe, that just said to the community, what we think we need here is some increased access to behavioral health services. And so the BHI was proposed, and really without a clear plan, over 67% of the community voted in favor of it, which is remarkable. And then through a real community engaged process, the plan was put together, and new services were added. We applied, put a proposal in for one of those programs, which falls under adverse childhood experiences. And what that program does is really try to recognize that when people are exposed to trauma at a young age, it impacts their overall health. And if you can be aware that traumatic events have happened in somebody's life, it might change your approach to how you actually intervene. And instead of saying, what's wrong with you, ask what's happened to you, and then from there have a deeper understanding of how you might help that person. And so we do that by working with systems-involved youth, kids that have been involved in the juvenile justice system or have had problems in school. And we really approach it by looking at their main support system, which is their family, bringing them a lot of case management services as well as bringing family members together and supporting the whole family and not just looking at it as an individual problem. So we have that program. We have added a peer support program with the support of the county, which takes people who have a lived experience of either mental health issues or substance use and have had some success in their recovery to help other people get services and stay in those services and hopefully have better outcomes. And we've also expanded our services. We've had a situation in the state for a long time where a lot of behavioral health organizations have shut their doors. And 2017, a strong provider in Bernalillo County for behavioral health services was Samaritan Counseling Center, and they ended up closing down their program. But we were able to work with the county, with the community, with the congregation of La Mesa Presbyterian Church to keep the services at a program that used to be called the St. Joseph Center for Children and Families going, and now we renamed it to be the Hopkins Center. That program really works with the community around La Mesa Presbyterian, which is in the International District, and is really looking at trying to provide culturally and linguistically appropriate services. So all of our therapists in Centro Savila are bilingual, Spanish speaking. I know there's many more languages to be spoken here, especially in the International District, but one of the largest unserved populations are monolingual Spanish speakers, and many of those families, maybe first-generation immigrant, but a lot of them also have been here for more than one generation and really have difficult access to services that are in their emotional language, in their primary language. And so that's a big priority for us at Centro Savila, to try to meet people where they're at with services that are really appropriate for them. And I know I'm missing a lot of services that we're providing, but I don't want to talk forever. But we are expanding our services both in the International District. We're going to be opening up a new office on San Pablo, over by the Young Children's Health Center and PB&J services. So we hope to work with families that are being seen over there. And we're also working out at the West Side Emergency Housing Center, which is a great endeavor that's happening right now, which is a collaboration between UNM Hospital, the county, the city, all to improve access to healthcare services and social services to Albuquerque's population that doesn't have a home to live in. And really with a focus of getting people housing as one of the first steps to really improving their health outcomes, but not waiting until that to provide needed services. The whole effort is to work collectively, collaboratively, and to move services from waiting till people are in crisis to preventing them. And when we do that, we save taxpayer dollars, we improve the general health of our community, and we make a statement about what it means to be from Albuquerque. So that's sort of what we do.
Great, thank you. Thank you so much. Thank you, everyone. So what we want to do now, and we have time after, it can be a sensitive subject, but we wanted to open it up for questions to any of our panelists. And just so you know, we are, again, live streaming it, so if you have any questions, we ask that you use the microphone. But I'll start off, because I have a couple of questions myself. So my sister, she owns a small business, and she often asks me, just because I work for the county, is there an opportunity to just have, and I know Deputy Dunbar touched on this, but for you to just come in and talk to businesses about the resources and what you do, just so that it's kind of a general discussion, and then they can individually just come to you and reach out to you. Is that a possibility?
Absolutely. I've had several conversations with various business owners, and that's something that I would be more than happy
So do
to
they
help out
contact
with.
you directly?
Typically, right now, it's either me directly by voice of mouth, just word of mouth, or they go through my Lieutenant Nick Huffmeyer, who will refer them to me. So either way is totally fine. It'll trickle my way eventually.
And Mary, just on all of kind of what UNM offers, is there kind of like an outreach person or a point of contact that we can talk to as far as kind of going out to different organizations or businesses to just talk about the different resources that you offer?
You can contact me, that's
Okay.
fine. We do quite a bit of that. Going out to schools and talking to kids at schools or different community organizations, we're doing quite a lot of that.
That's great. That's awesome. So is there any other questions or anybody have any questions? So the panelists are going to be around for a little while, so you can ask questions. And then I know a lot of them have business cards, and so you can contact them directly or reach out to them. Go ahead, ma'am. If you would, need you to come to the microphone. Sulema, will you grab? I don't know if she's tall enough.
No, that's good.
She got it? Oh, she is. We're good.
Well, actually, I'm here because I'm a volunteer at Del Norte High School, which a lot of people think is a middle-class school, but it's not. It's a poverty school with a lot of students that have experienced trauma, and I mean, every day it seems in the paper that there's been a murder or a domestic violence or something in the neighborhood around Del Norte. So my curiosity is, how do you deal, I mean, APS is such a large organization. How do you deal with, which departments at APS? Because the bottom line is the counselors that are at the school. And that's why I came today, just to take notes. So I think I want to hear from you, and perhaps you, and, well, maybe everybody. Okay.
Thank you for your question, and also thank you so much for the services that you are volunteering at the school, because I think one of the most important things our youth and our community need is that connection. What trauma does is it separates us from people who can support us and help us to kind of regulate. So I think the work you're doing is amazing. To answer your question, I don't think there's one area of APS that we are trying to support. We offer training to counselors, and a number of counselors from APS come to our trainings every time we offer them. We have 2 this month, and I expect that both of them will be filled with counselors from the schools. We provide services in the schools. CCSS services are out in the community, and so children and families can request for some of that support to happen in the school setting. And that's a great opportunity for us to connect with teachers and coaches and the school counselors and social workers, and figure out how to really team for these students. And then we also offer something that's called wraparound services, which is really comprehensive and never looks the same way twice. But it's really with the intention of keeping kids in their homes, in their communities, to prevent them from having to go to a higher level of care. And that often looks like including people from the school, principals, teachers, systems personnel higher up, not just touching the student directly, to see how can we support the kids, keep them regulated so that they can learn, meet their goals, and become successful. Thank you.
One of the things that we know is that, there's just not enough services throughout the county and definitely in the schools, and we have several MOUs with APS schools to actually provide services in the schools. One of the programs that we do is called Strengthening Families, and what that is really a prevention class. It's parenting classes where we bring parents and children in together. We have a meal together after school, have dinner together, and then we separate out the parents and the kids, and they both are addressing issues that come up during adolescence. It could be alcohol and drugs, it could be bullying, it could be sex and how to protect yourself, and very difficult topics for parents to breach with their kids. And we train parents on how to have these difficult conversations and really try to get both parents and kids to stand in each other's shoes and understand what that experience is like. So we've been working with several schools, middle schools, and so really it's about trying to move some of those services towards preventing the kind of things that happen down the road when people aren't prepared to address those issues with their kids. We also bring our counselors out to schools to actually do therapy in the schools if the school is willing to have us there. The one thing that we've learned a lot of times when kids get sent to the counselor at school, they think it's a punishment, and so a lot of times they get over that and they go, oh, wow, this actually is helpful. But it's really important for the way kids are experiencing the school system that they get the supports that they need. Sometimes we found it's easier to do it close to school, so it's really easy for them to get there, but not in the school. I think we need more school-based services, and we just need to educate everyone that going to see the social worker or the counselor is really a support, not a punishment.
Great. Yes, ma'am, please.
I think this is probably going to be addressed to Mary, because I'm actually sitting here because I have a loved one in my life that needs the comprehensive services which you are describing, and he's been bounced around the UNM system to the point where his mental health, his physical health, all of it he's pretty much spiraling, and he makes phone calls and ends up not hearing back, or no messages are left. So I'd like to just address the pulling together of mental and physical health services, and I wonder if those type and case management to basically help a person when they've, I guess, what services or how can this individual access these services in a way that he's not sitting around waiting for a phone call that never happens, or I'm not sure how to proceed with the getting this ball rolling for somebody who is in desperate need.
Definitely, I'll give you my card and give me a call. I think that is a big problem. I mean, when I need to see the doctor and I know the system, I have good resources, I have trouble getting in. So that's what you were just talking about, social determinants of health. We're seeing now that how big a part that plays. And then people have made references to trauma and the ACE information. We know that causes actual genetic changes now in the study of epigenetics. So people, there's a feeling that sometimes, not in your case, but that people are being just behaving badly. And it's like once you experience that kind of trauma, it's almost like you're on the rail runner and you're going to Santa Fe. And unless you've given some very specialized tools, you're going to Santa Fe. And we work with people to try to offer them things to, become more regulated, and so that they have choices, because until they get some kind of help, it's very difficult to have that kind of choice. The other thing that's so important is when a person wants care, we need to be able to give it to them. And it's difficult with so few resources. So to me, we have to think bigger than organizations. It needs to be like we're trying to do community education and help people support other people even in the community. This is not going to get fixed by a few organizations. I mean, we all are passionate and we all are doing the best we can, but it's going to take more.
Thank you.
Yeah, I'd like to follow up also.
Yeah, please.
Really, the behavioral health funds that we have now have the potential to do a great deal of good, and we're still, I think, at the beginning of figuring out how do we do that. I've had the experience of taking a young person to try to get case management, and the question was, is he on probation? No, he's not. Oh, that's too bad, because he could have got more services if he was on probation. So, if he was homeless, he could have had more services. So we've set it up so that you have to hit rock bottom in order to get services. And I think the funds we have now can start to fill in the gap from, rock bottom towards preventing people from getting into worse situations. And that's gonna take a lot of work, and we have to develop some things that we just don't have, right? I've taken somebody to Matt's who wanted to detox from spice, and they didn't have the services for it. And so they handed them a flyer and call all these places, and it's like, when somebody wants to get clean, you might only have 15 minutes before they change their mind. And so we have a lot of work to do to build up and fill in the gap, and hopefully this extra money that we have now will help us get there. Because there's all these grants, and they all come with their restrictions, and they can only serve so many people. So having funding that's flexible, that allows the gaps to get filled, and I know the county's actively working on trying to figure out how to fill gaps, is important, right? Because otherwise, we create the cracks that people fall through, right? It's not that they just happen to fall through the cracks. Those cracks were put there. And so now we have the opportunity to kind of start filling that out, and I think that's really an important thing. The other thing is looking at how do we build communities that support people's mental health. And when we talk about healthy eating, actively, a lot of people think of that as individual, what do I eat, or how do I go exercise? But it's really looking at how do we build a community that encourages people to get out, interact with each other, and be healthier in that way.
Yes, ma'am. Sorry, she added a. How about who can get there first, and then we'll let's race.
I worked with the Mental Health Center in 1970, and to me it was one of the best models I have ever worked with, and I've worked in a lot of places. So the reason it was so successful is that we had a team, Martinez Town, South Valley, North Valley, and each part of the city had a team, a doctor, social workers. I know that's probably pretty hard now. I don't know for sure. But we worked very closely with the mental health center. I was working the mental health center at that time in inpatient, and we had a team inpatient. So a patient could come in, and we would treat that patient, and then we'd go back to the team. So we were working together, and all the teams worked together. Like, I think you were just talking about, or who was it, you? What I'm finding now is things are really changed now. I find it, I'm a social worker, by the way, and it's very difficult to find, to refer people places and get them in. Everybody's closed, or everybody doesn't have time, or everybody's this, or everybody's that. So things have changed a lot, as far as I can see, in Albuquerque. But that model was so fantastic. And we also used the medical school. We used internships, residents. I don't know if you're still using all those people or not. They were very helpful. They were out in the community a lot. But when you talk about connecting with all these different, that was the good part of it, because each team knew all the resources in that particular, and you could move people from inpatient to outpatient, and it was smooth. Yeah. And we had really good staff. The other place I worked is I went from from the mental health center to, I set up my own business in employee assistance. It was incredible. First you had to market. had to sell companies on the ideas of, I had my own model, I built my own model, something you people ought to think about. Solutions is probably a good example. You probably know Solutions, right? I think they work primarily out of Presbyterian. But the working environment, or the companies were incredible. So I just went out and sold the idea of mental health. And they allowed me to go into the companies. And through my model, I taught them about mental health. We could bring in all kinds of programs. We, first of all, they were very open to therapy, to getting help. And they could come to you. You, as the person that ran the mental health center, could set up a model, and they would come to you. And then you would make sure to get them where they needed to be. And with the insurance companies, you could, with the EAP programs, most of the people had coverage. And if you didn't have coverage, of course, this is where you would go to the mental health center, to different other resources. And I want to tell you, it's something to think about because, first of all, they were very open. I always went to the manager. I always went to the top dog. And they were so happy for the idea. I don't know if you're dealing with any EAPs or not, but they're an excellent resource.
Could I share something? I've worked in an employee assistance program, and in some ways, our public sector can learn from the private sector, or maybe the employee assistance program, the EAPs, learned from the public sector back when you were working,
Public sector.
when we were trying as a country to get services out to the community. EAP really started with the recognition that if one of your employees is struggling with a mental illness or substance use disorder, it's a lot more expensive to fire them and hire a new person. It's a lot more humane to offer them the services that they need so that you can get them help and retain them, and to really value.
Are you talking about staff now, or are you talking about? Oh,
I'm talking about if you're a corporation or organization that wants to prevent the loss of your staff, you provide those services, you make them accessible. So EAP is a model where everyone pays a little bit out of their paycheck, but then when you go to see the counselor, it's free, at least for the first 6 sessions or so.
yeah.
And so
That's
then,
part of your model.
right. So that there's something that we have to learn about that publicly, especially in a state like New Mexico, where we have such a high population of people living close or in poverty. And their only access to health care is Medicaid. And for many people, even if they're longtime residents of Bernalillo County, they may not even have access to Medicaid. So that model, I agree with you, is a model that we need to figure out how everyone in this county, when they're running into difficulty with alcohol or drugs or serious mental illness, that there shouldn't be all these, gatekeepers that are saying, hey, let me see your insurance card, or let me see where you live, or let me see, all of these things. It can really be a lot more affordable for our whole county, for our whole country, if we just say, let's get you the services you need and recognize your value as a human being to our company, to our society, and get those things out there. Right now, so many people are falling through the cracks.
Yeah,
And people with substance use disorders or with mental illness often fall into the blind spots of our community that we don't see
They
them.
don't even know where the blind spots are.
Right. So I think it's part of what I see the county trying to do right now is take a look at our blind spots. Who is falling through the cracks? Let's get the services out there, and let's make them accessible rather than putting up all these really artificial barriers that prevent people from healing and have a huge cost down the road.
I don't want to take up all, because he wants, our company's paid for a certain amount of sessions.
Mm-hmm.
So first of all, you train the people about you can go right into the companies and have sessions of talking about mental health. And then they can self-refer. It was for the family and the individuals that you get 3, sometimes 6 sessions. The company pays for that, remember. Right. They don't use insurance for that.
Right.
And most of the people are very skilled therapists. I had 9 therapists in my office, so that they could be evaluated fairly quickly. And we knew all the resources in the whole state.
Right.
But the good thing was they learned about mental health. We taught them different kinds of things. We had sex training, that kind of thing. But the main thing was to evaluate them and get them to a good resource. It didn't matter how, a lot of these people are working. So the company paid 3 sessions to begin with. Many times they had insurance, and you had to know the resources in the community, and you can refer them right away.
Right, having
it was huge.
An open door.
And we had many more. I don't know if you remember Heights Psychiatric Hospital, which they took down, was one of our best hospitals. We worked with all those people so that things move very quickly. But
Yeah.
I think we as therapists ought to do more of that kind of model. I really do. And I love the model with the mental health center.
Right, and thank you for sharing. And just, I think the funding structure has changed on who pays for or who funds for mental health, which is one of the reasons why Bernalillo County response was to do the increment. So yeah, I think there's been a lot of changes since you've been in the industry, and I think maybe some for the good and a lot for not the good. So yeah, we'd like to hear more from you on your thoughts and ideas, but this gentleman, you had a question, sir?
Just a quick question. I run a mental health agency here in town, and so I kind of came today to kind of get ideas. We're always expanding, kind of coming up with new programs. So I kind of wanted to ask the question to the panel. What areas, especially with youth and kids, do you think we have these biggest gaps, especially on the prevention side, that maybe we can expand into with our agency or other agencies that are out there?
Okay, I'll go. I think really for youth, what we have the opportunity to start providing is support around healthy relationships, right? There's a large number, looking at gun violence, lately, there's a large number of folks who get shot by their partner, right? And so having healthy relationships is a key part. There's a lot of work needs to happen there, and also just in general, that creates conflicts, and those things impact the workplace, right? People don't know how to resolve a conflict, and when that happens in the workplace, it makes work bad for everybody. So I think really just kind of what are healthy relationships, right? We teach health in public school, and we teach sex ed very mechanically, right? Here's how these things work, but without any of the kind of emotional or negotiation or kind of dealing with rejection, right? All of those things that are important to just have a healthy life. I think those are key things, right? Young people need to know you're gonna, growing up, I applied for a job and I got a job. Now you apply for 10, 20 jobs and you get told no 10, 20 times. And we're not teaching people how to deal with that rejection, we're not teaching young people, how not to abuse each other, right? There's a lot of bullying and things that go on. So I think dealing with youth, those are things that impact whole communities, right? You know, one bully bullies a lot of people, right? One person who's bad at not accepting rejection can end up hurting a lot of people. People with bad relationships, you know, tend to have more than one relationship, and so they impact more than one person. And so I think, for me, those are just kind of things I see that would be important from, you know, behavioral health, mental health approach.
Does anybody want to add to that? No? Good. Okay, well, we're going to wrap it up. Thank you, panelists, for being here. We appreciate your time and your energy. And if you guys have, please take some food as you're leaving, because I will not eat it. But yes, and thank you so much. And if you guys have any questions or want to get their cards, they all have cards up here. And thank you, Commissioner Hart Stebbins, for sponsoring and hosting. And she's, you know, the reason why we kind of all get together and try to get these things out to the public. So thank you so much, Madam Chair. And then Marcos, do you have any other information we need to put out? Oh, so he has everyone's contact information on a one-sheeter that he can provide for you as you are leaving. Thank you all so much, and have a great day. And just a round of applause for our panelists, if we could. Thank you. Thank you so much. Have a great day.